Feel a little leery about this. I'm kind of used to talking, but most of my talks are about strictly data and scientific stuff. This is the first time in my long life that I had to talk about myself. And as I looked at my life, I decided to talk about stuff I haven't even discussed with my other family, meaning my non-dyslexic family, because they're personal things, but they have a lot of implications in what it's like growing up in a non-enlightened society as a dyslexic. I was born in 1930, which makes me 83 years old, so I'm an old guy. And in that generation, the education people were not particularly enlightened about things like dyslexia, or for want of a better term, learning disabilities. My parents were the first generation from an immigrant parents, that the only way to get ahead is be smart, have a good education, and be a professional man. So it was not a good idea to be dumb. And this first slide sort of tells a story. I hated school with a passion because I was a dumb kid. How did I know I was a dumb kid? Because in my second year of grammar school, this stern lady walked in with a piece of paper and she read it off of 4 names, and I was one of them. And she said, "Come with me." And we went, and I said, "Where were you going?" One of the kids beside me said, "To the dumb class." And so for the next years, I went to these, quote, dumb classes. I could read, but I read a funny way. I kind of jumped through, kept on saying, "What's this guy trying to say?" And I could get it, but when I finished it, I didn't know the name of the heroes or the people in the book, and I couldn't know any of the dates, but I had wonderful reading comprehension. The things that really got me were things like math and arithmetic. I couldn't understand ratios, equations. When they tried to do any of that, I'd completely blank out. And I couldn't remember numbers. I would look at a telephone number, and then I'd look over to dial it, and I'd forget it. And it was terribly embarrassing. And if somebody started the alphabet and they told me start at L, I couldn't do it. I'd have to go all the way back to A. Where I really got in trouble with pronouncing words. I learned a lot of big words, and that even happened when I was a professor of surgery. I still couldn't pronounce the damn things, which made my residents love it, you know, because all surgical residents want to get the chief. Well, 2 things happened in high school that kind of changed my life. One was one of my friend's father was a wrestling coach, and he decided it was time to teach his son wrestling. And he got a bunch of his old coach buddies together who had kids about my age too, and about 4 of us started a little wrestling club. And since I was a friend of the coach's son, I was there too. And I found, for some reason, I could do that good. I couldn't do math and everything, but I could knock somebody else down pretty well. And I was kind of cozy about it too. I'd sneak up on them. And so I had that thing that worked out pretty good. The other thing that happened is I got involved with this lady, Miss Porter. And Miss Porter was the guidance teacher. And she came in my senior year at high school and said, "All kids who want to go to college, raise their hands." And of course, everybody was raising their hands, so I raised mine too. Nothing happened, and 2 days later, she asked me to come to her office and gave me an envelope and said, "Bring this home to your mother." And that was a turning point in my life, because I brought it home, and my mother came and had a conference with Miss Porter. And that night she came home and said to my father, "We need to talk." And I listened, and they said, "Miss Porter said that Mark's a nice boy, but he's below normal intelligence, and it would be a tragedy if he ever went to college." And my father, who always felt something's wrong with me, I'm a thickhead, which was his favorite term, said, well, he better learn a trade. So he enrolled me in Wentworth Institute to learn to be a welder. So I was looking forward to being a welder, and I actually was was in welding school when, next slide please, something funny happened. I was in Boston working out in the gym, and I saw on the wall a poster, New England AAU Wrestling Championships. And I said, that sounds like a lot of fun. I ought to try out what I've been learning, whether it works. What I didn't know is all the college teams, particularly the Ivy League teams, at the end of the year, brought all their teams down to compete in the New England AAUs. And I didn't know that, or I never would have done it. But anyway, I started out early in the morning, and it was eliminations, and I won the first bout, the second bout, the third bout, and finally, at about 8 o'clock at night, I looked across the mat at the finals, and there was the captain of the Brown University wrestling team. And we were competing for the 165-pound championship. We went 3 rounds, and we were tied, and then we went 4 overtimes, we were still tied. It was now 10 o'clock at night. The referee was getting very frustrated. So he gave the gold medal to the brown guy, the elite snob. And he gave me the silver medal. And as a teenage boy, I stormed into the locker room, and I'll never forget it, threw the medal down and started taking a shower. And then this little bald-headed guy come walking in, and he kept on staring at me, and I felt like saying, what are you, a pervert or something? And he finally said, hey kid, is it true that you really go to high school? I said, yes sir. He said, well, why don't you think about college? I said, no, I can't do that. He said, why? I said, well, I'm kind of dumb. I'm not too good in school. He said, you know, it's a funny thing, and this is probably an important point. People coming into your life. He said, I watched you wrestle since early this morning, and you're not dumb. And he said, I'll tell you what. He said, give me your name and address, and I want to write you a letter. So I said, okay, and I forgot about it. 2 weeks later, I got a letter with a round-trip ticket to Providence. I live in a little town near Boston. And I said to my father, I'm going to go up to Brown University. He said, what are you going to do that for? He said, you'll never be able to go to college. And I said, well, what the heck, it'd be a free meal, Dad. And so anyway, I went up there, and they took me in this room, and for 2 days they gave me tests. And I remember one of them was an ink blot, which really kind of tickled me at the time. And then I went home. They never said much. I got some free meals. And 2 weeks later, I got a letter from the Dean of Admission admitting me to Brown University without even an application, which, okay, well, that sounded pretty good. But next slide. And then something happened there. First, it was like a kid in a candy store. I could take all the courses I could do and completely ignore, I thought, the ones I couldn't do. So I did that, and I was real good in history, and they admitted me to a seminar course in this little old library here, John Carter Library, and that was my first real change in life, because what happened is these kids, like were senators' children, poets' children, they'd been around the world, they read, they went to museums, they knew all that stuff, and I sat there, and I said, you know what? I'm not dumb, I'm just ignorant. And I said, and you know what? That's probably fixable. So I subscribed to the New York Times, true story. Okay. The other thing I noticed in talking to them, there was a whole world in your mind. And that was introspection. I used to say, what does this mean in the great scheme of things? But I realized that you could look within rather than look without. And that was an interesting insight for me. Next slide, please. Then reality came up. I was doing great in college. I was Phi Beta Kappa. I was on the dean's list. I was captain of the wrestling team. I was undefeated for 3 years. I was having a ball, and I got another phone call, and this was from my advisor. And he said, hey, Mark, do you realize you haven't taken a foreign language course, and you can't graduate from Brown unless you're proficient in a foreign language? And he said, what language do you want to take? And I said, well, I flunked French 3 years in a row. So I said, well, I'm proficient in French. He said, all right, I'll sign you up for a beginning course. And I knew in my heart I could never pass French. So I said, well, is there any other way to do it? And he said, yeah, you could take a French proficiency test, and if you pass it, you don't have to take a language. Well, the gym was 3 miles away from the campus. So I bought these little cards, these little index cards. On one side I wrote English word, the other the French word. And for the next 2 weeks, I walked back and forth to the gym and memorized the whole French vocabulary without knowing any grammar or anything else, okay? But because I could figure it out, I took the French proficiency and passed, and I got away with it, okay? And I thought I was going to get away, and then I decided, and I won't go into it because for time reasons, to be a doctor. But what happened was I forgot to sign up to be a pre-med. So what happened then is, well, I applied to one medical school, Tufts, and they looked at it and they said, here's a guy who's graduating summa cum laude, he's got high honors, he's the captain of the wrestling team, he's an undefeated athlete. So they took me, and I think they forgot to look at that I didn't take basic science at all. And then I got in a real serious trouble because I made one other mistake. I moved in with some other students, and I tried to study and learn like them. And at the end of a couple of months, I got a call from the dean, went in, and he said, kid, you're flunking out. And I realized I was. I mean, I knew it. And I don't know why I did it, but what I did is I packed up my bags and said, I gotta teach myself. And I moved back to my parents' home. And what I did is I'd go home at night, have dinner with my parents, and then go to bed. I get up at 2 o'clock in the morning and set up my own medical curriculum. And I did it with the New England Journal of Medicine that has what they call CPCs. They're case studies. And what you do is you study it, and then it's like a whodunit. So I would get all of them, read them, and then I'd have all the books, and I'd teach myself that way. And I managed to stagger through medical school the first couple of years. Then I got in the clinical part, and then it was easy. And so that worked out pretty well. And next slide. Then I got an insight. I realized things like pH, when they showed me that, I just blanked out. So I said, these are these complex physiologic things. How the heck can I understand them? And I said, you know, by drawing pictures. So I got a book on cartooning, and I decided to draw my pictures for all the physiologic things. And it's interesting. This is from the standard textbook in pediatric surgery, talking about the gut barrier and these little bacteria jumping over the hurdle to cause sepsis. And so I used to do that with all my slides. And believe it or not, even though I didn't like public speaking, I became a very demanding public speaker because I had neat slides and seemed to be able to explain things. And these little stars are the places where I've either given endowed lectures or visiting professor lectures within the world, which always staggered me because I figured, what the heck am I doing here? But it was really because of the cartoons. Next slide. I decided to be a surgeon in a funny way. I didn't like the other students because all they talked about grades, so I didn't want to eat lunch with them. So I wanted to find a quiet place, and that was the surgical amphitheater. So I used to eat my lunch watching the operations in the surgical amphitheater. Honest, it's a true story. And what happened was, the surgeons noticed me up there and said, what the heck are you doing up there? And I told them, and they said, well, come on down and really see what we're doing. Got friendly with them. They asked me if I wanted to work with them in the animal lab doing research, and I said, yeah. So after school I'd do, and they taught me how to do surgery, and that's where I realized I found something not only I was good at, but I loved it. And you know, it was funny. When we have what we call train wrecks, terrible, terrible case, and we're closing it up, it's 2 o'clock in the morning, but we knew the kid's gonna really do well. And we'd look at each other and we'd say, you know, if they didn't pay us to do this, we'd pay them to let us do it. So that was a blessing, to find something that you could do well and that you loved. And I was very lucky. Next slide. I had my training at Boston City Hospital, which is a big charity hospital, And if you know anything about the old days at Charity Hospital, no supervisions, the motto was see one, do one, teach one. So in other words, I watched somebody do an operation, then I did one myself, and then I got an intern and showed him how to do it. It wasn't, and that's the way it was in the old days. One night, and I was on an admitting team when I was an intern with a senior resident, and one night they would operate and admit, and the next day we would clean up, take care of the patients. And the worst and most difficult diagnosis is whether to go back in if there's a problem post-op. Very hard to diagnose. So we were the cleanup, and Dick and I, the senior resident, would go back and operate on these guys in this little old dirty Boston City hospital. And one night at 2:30 in the morning, we're sitting there and trying to decide whether this old alcoholic who had a stab wound was leaking and had to be taken back to the OR. And Dick was sitting there with his head like this. And I was tired as anything. I said, what the heck are you doing, Dick? Let's decide and get the heck out of here. And he says, shh, don't say anything. I said, you know, you're cracking up. He said, no. He says, I'm listening to the little men. He says, back here are these little men. They don't go to the grand rounds. They don't go to the journals. They don't read medical journals at all. They don't go to conferences, and they only talk in whispers. But if you listen very carefully, they always know the answer. And as soon as he said that, you talk about aha experiences. I said, son of a gun, he's right. And for the rest of my career, I always listened to the little men, and it's kind of a family joke because the kids would say to me, hey, Dad, what do the little men say? But I take this very seriously. Next slide. I'm going to jump ahead to being a pediatric surgeon and tell you a little bit about, these are sort of observations that I never understood, and some of them I still don't, but I found I did things different than other people. And, you know, this has been a tremendously enlightening time for me, meeting you people, because it seemed that I was coming around from the other end. And the way I operated 3 times on a difficult case. The night before, I'd kind of sit down somewhere, and I'd start doing the operation in my brain. And I'd actually see it, even the incision, and I'd figure out, well, I better not go there, I better go there. So then, when the operation started, I could just sort of walk up to the table, pick up the scalpel, make the incision, and get going. Okay. The other operation I did was the night after, and I always said that was the most important one, because I do the operation all over again and was very, very unhappy. I think only once in my whole life have I ever been happy with the way I did it. But I would go through it again and say, next time I'm going to do this, this, and this, you know, and it was what I call lessons learned. But an interesting one, which I never figured out, and this is actually a picture of me, that somebody snapped in the operating room sitting beside the table. And what had happened in this case is there's a thing called thoracic dystrophy in newborns where they're born with a chest that's crushed like this. So even though they got normal legs, their lungs can't expand. So as a result, within 2 days, if they have severe respiratory deaths, they all die. And I kind of got sick of seeing these little kids come in and dying, and I decided I was going to open up the chest and let the lungs expand. And I kind of figured out how I could do that, and so I did. And I got the chest open, and the lungs expanded just like I thought they would. And the anesthetist said, that was great, you've got oxygen now. And so then I looked down there, and the heart's beating, the lungs are out there, and I tried to get it together, and of course every time I pulled it together, it pushed the lungs together. And I kind of said, uh-oh. And so what I did, and I'll never forget it because I didn't plan this, I sat down in a chair by the operating room. You can see I've got my hands folded so I don't get contaminated. And this was actually this is a picture of me in that particular situation. And I started doing 3 different operations in my mind. And the third one worked. And then I went and I did it, and it did work. So it was interesting because it brings up the whole thing about how dyslexics visualize and so on. Next slide. I was reluctant to show you this slide, but because it's a very personal thing. But I decided to show it to you because I don't know what part of our characteristics this takes into consideration. And this is a beautiful family. It's not the actual family, but the rest of it is an actual case of a beautiful little boy and two loving parents who treasure this child more than life themselves, okay? Unfortunately, this is a CAT scan of this kid's malignant neuroblastoma. And here's the spine, here's the belly, here's the liver, and this entire space is filled up with this massive malignant tumor, and this is the spine right here. And if you look at this picture here in the dotted lines, this is involving all those vital structures. What we used to say, it's where the kid lives. Now, this is not to be dramatic, but this is actually what happens, okay? I have to decide if I cut right about here, see if I can get this thing to go. Okay, if I cut right along that dotted line, it's a safe area, okay? But I might leave in a small amount of tumor. Nobody would know that I did that but me, okay? But there's a very good chance, probably 90%, there'll be some spillage and there'll be a recurrence. If I go just a millimeter or two to the side, I can cut in there and be free of the tumor, but there might be a lumbar vein that comes up under the vena cava that I can't see, and there's no way I can tell. So here I am standing with a knife in my hand, and I have to decide which way to cut, okay? If my mind then shifts for a second to this lovely parents up in the waiting room and me walking up and saying, your child's dead, what am I going to do with that knife, okay? And this sort of happened in my career about once a month, okay? Now, what happens is you go into a phase where you recognize there's an emotional component and you say, don't bother me now, I'm busy, and you concentrate on the task. So it's almost like being schizophrenic. You split your mind and say, I'm busy now, come back later. And what you do is then say, the best I can do for this kid is to focus on what I need to do, not worry about all this other stuff because that's extraneous to the job. Well, you can do that, but there's two things that happen. It changes you, and you kind of feel like a monster after a while. The other thing that's interesting is it rubs off on your family, because it's very interesting. My kids are all grown now, but one thing my daughter said to me, my oldest daughter, the other day, when we were talking about one of the problems with the kids, she talked about that, and she said, you know, Dad, that's one of your least nice characteristics, you know, and I always resented it, that you'd always look at the business rather than all the emotional stuff about it, and it kind of hurt me, but I don't know that ability to be able to switch or not is part of the way our minds work, being able to divide things up, but I bring it up for your consideration. Next slide. This case brings up another thing that I think might be related to dyslexia. And this was kind of an unusual story. I was an assistant professor at the University of Chicago. I was out of my residency 2 years, and somebody came in and said, you gotta see this. And I said, beat it, I'm busy. And they said, no, you gotta see this. And he had kind of a silly grin in his face. So I got up and I went into the delivery room, and there was this little baby lying there in a bassinet, and the mother was being closed up from a cesarean section, and it was completely crowded with medical personnel taking pictures and looking and hovering over him. And I didn't think about this, nothing at all. I walked up to the baby, looked at the baby, and I said, okay, to the nurse, I said, move that bassinet into the surgical ward. I accept this kid and transfer. And one of the pediatricians said, "What are you doing?" I said, "I'm going to fix him. Isn't that what you're supposed to do?" And I didn't say that with bravado or anything. It just seemed like, you know, if you're a pediatric surgeon and you see something, you're supposed to fix it. That's what you do, fix up little kids. And so I just did it. And then the next thing, I got the kid there and we'd start studying him. Then kind of reality stuck in. Because it turned out this kid had this little omphalocele where his intestines come out through this thing. The child had 4 legs and all of them had club feet. The child had a complete second pelvis. The child also had 2 small intestines, 2 colons, 2 rectums that were imperforate, 2 bladders, 4 kidneys, 2 uteri, and 2 vaginas. And so that was another characteristic, is life's a marathon, not a mile run. And I'll never forget it, running the Orange Bowl Marathon. Getting towards the end of it, I saw a guy staggering, and I said to him, "Can I help you?" He said, "The only way I'm going to stop this marathon is if somebody shoots me." And that's the sort of persistence that you sort of, when you're overcome with this multiple pathologies, you just got to take it one at a time and keep pushing. And it was sort of a lesson I learned, and I kind of, and the thing is about all these things, none of this I took any credit for, because it seemed like that's the way you're supposed to do things. You know, you're just doing your job because that's the way you were trained, and you seem to be able to be blessed with having the skill to do it. So it never seemed to me to be a big deal. Next slide. Okay, so here we are, and if you know anything about surgeons, they're not particularly nice people. They define themselves by what they do. It's a meritocracy. You can be the most miserable SOB in the world, but if you're really good, you get somewhere, okay? And, but if you define yourself by what you do, and here's me, I'm the Surgeon Chief, endowed professor, department chairman, director of the American Board of Surgery, president of the American Pediatric Surgical Association, past president of the American Academy of Pediatrics, LAD medal holder, author of 6 books and 150 papers, one of the editors of the Journal of Pediatric Surgery, one of the 3 founders of the American Board of Pediatric Surgery, multiple NIH grants, a surgical training program director and trauma center director. How the hell am I going to retire, okay? But the time to take a pitcher out is before he throws bad balls. And that's particularly true with surgeons. And then what I learned, which I really am grateful to dyslexia, that one of the things about dyslexics is they're curious. And this is, of course, Curious George, my kid's favorite thing. And I was curious. And all of a sudden I said, all that was in the past, but this is the future. And I'm going to become, as my wife said, a second adulthood. So I decided, okay, that was then, and that was the last talk I ever gave in pediatric surgery, my presidential address, and then I never gave another one. In fact, this is the first public talk I've given since I retired. Okay, so what did I do? I said, I'm going to learn a bunch of stuff. I joined the Coast Guard Auxiliary to learn about navigation and patrols and all that stuff. I learned Tai Chi and formed a company and teach balance for senior citizens to prevent falls. And I got involved, which is a crazy story, in competitive powerlifting. And I like to woodcarve. Really appreciate your time. Thank you.